Hi everybody, it's Coach Julio, and I want to do a video on an underreported inequity, and that is ageism. So, if you don't know what ageism is, or if you do know what it is and you want to learn more about it and finally learn how to stop it, this video is for you, so keep watching. The main objective, more than one, of me discussing ageism is just to bring public awareness and help you possibly get a better understanding if it's a new term for you, see if it applies to you, and secondly, how we can work together to stop it. So again, I'm going to share with you some links. You can easily Google the term ageism and it will come up. And there are a lot of organizations, local and nationally, that are working every day to fight it. So what is ageism? And again, this information I'm reading off is Medical News Today, and the link is in the description and at the bottom of the screen. So what is ageism and how does it affect health? Just in a general way, it's ageism is prejudice or discrimination against people based on their age. It typically applies to people who are older, but can also affect young people. Ageism has a negative impact on physical and mental health, and reports link it with earlier death. So it's an inequity. It's the bottom line, as you heard me say, it can go both ways for younger adults and also older adults. For this video, we're going to specifically talk about older adults and healthcare. And I'm just going to touch upon a couple of other topics related to this. So now I'm going to give you some data from the 2020 National Poll on Healthy Aging. Found that 82% of older Americans reported experiencing ageism regularly. The survey found that 65% experienced ageist messages from the media, 45% experienced interpersonal ageism, and 36% had internalized ageism. So why not give you some examples of ageism? Ageism comes in many forms. Some examples in the workplace: refusing to hire people over or under a certain age. Again, I'm just going to give you some examples. You can Google this and you can learn more about it. Enacting policies that unfairly privilege one age group over another. Asking for someone's age at a job interview when it's not relevant to the work. And I'll share a personal example. I had a client of mine share. So she was getting gray hair early on in her 20s and 30s, and she purposely colored it for job interviews because she feared, see where I'm going with this, that she was not going to get the job. And how do we know if we lose opportunities? Because the other party are not explicitly going to say it's because of your age. See where I'm going with this? So we can also be losing opportunities or benefits because someone is practicing ageism or they are unaware that they're doing that. So at the end of the day, my firm belief is that this inequity, ageism, can be unlearned, and that's through education, and that's what I'm trying to provide here. Now, let's talk about stopping ageism. The WHO states there are 3 ways to combat ageism: education to dispel myths and stereotypes and raise awareness of the impact of ageism, such as we are doing; intergenerational interventions, which creates cooperation and empathy between age groups; law and policy changes, which can reduce inequity and discrimination. So you see where I'm going with this: becoming aware of it, learning about it, developing skills, and at the end, taking action. Now, if you are a healthcare provider, I want to read this, and it's from the European Journal of Aging. And I'm going to have this also, the link in the description. And I found this very interesting. So further interventions, this is again specific for healthcare providers, also social workers can be. Listen. Future interventions should explicitly address the challenges that healthcare professionals associate with working with older adults. So what that is basically saying, healthcare providers also experience some challenges working with older adults, specifically in light of the limited resources available in the healthcare system. This should generate a candid discussion of emotions and thoughts that develop in the presence of older adults. In the course of medical training, there is a need to further explore the implicit conflict involved in providing too much treatment, too little treatment, or simply inadequate treatment to older adults. And then that link and source is in the description. So there you have it. I hope you found this video useful. We can work together to stop ageism. Please post your comments and don't forget to subscribe.